What are we doing on him?
We're doing the cough machine.
Cough machine. And how often do we do cough machine?
Every single day.
Yep, and sometimes twice. And sometimes 3 or 4 or 5 or 6 times if you're sick.
Oh yeah.
Alright, now tell me, what's this button do? What's that button?
Turn on.
On. These are the settings that we have. Every kid's kind of different. We have it set for inhale 1, exhale 1, pause 1. We actually have a Sharpie pen on tape, and it's here in case we have to take it someplace or she goes to camp. So that way if it gets adjusted, whoever's taking care of her, helping her out, knows right where the things go. So, it'll be easier when I show you. We always have it set on the, let me see, automatic one. Some people do manual where you do inhales only or whatever. We never have. We always have it in automatic. So switch the sucker on. In, out. Now, keep looking at the dial. Here's the mask. I blocked the mask so you can see her pressures. Autumn goes 40 inhale, 40 exhale. A lot of doctors are afraid of those pressures. Can't figure out why. They use them on very weak children with SMA type 1. Babies, infants, we've used 40-40 pressures since Autumn was probably 2.5 years old. Autumn, does 40-40 bother you? Or is it good?
No. It like blows your cheeks out. Like
this. So in it blows in. Wait a second. In it blows in and out. You try and cough with it. Usually we don't get anything up. If we get something up, it usually means that she's sick. If she's not sick, we use it for lung expansion, so she's able to breathe a little easier at night. So we usually do 5 sets of 5 in and outs. More if we need to. When she's sick, we hit this thing probably every hour we've done. I've slept on the floor with it. If you need any machine, this is the one to get. This is pretty much a life-saving device. This is why our kid is so healthy. So we'll start first round. Open up. Does this hurt?
no.
All right, ready? I exhale and you wait for an inhale. You have to mash it pretty tight. So we go in, 1, in, 2, in, 3, in, 4, in, 5. Now we give her a little break. Depending on the age of the child, depending on how much they're used to it, they might need a little more of a break or a little less of a break. Autumn is pretty good. She's an old pro at this.
Ow.
Autumn, how's the cough machine feel?
Good.
Good. What happened when your little baby did this? You didn't like it, did you?
No, I don't. But don't be afraid of it.
No. But do you just like it when you're sick or not really? It kind of feels icky for her when she's sick, but we do it because it's a lot better than.
I have to show something. Like this is the filter, and you see this? You see this big long hose?
Careful.
That is the biggest, ugliest hose. But that is the mask.
All right, can we do it again?
Sure.
Let's do it again. Ready? Let's do
1, 2, 3.
Ready? Okay, we go in, 1, in, 2. Now we usually do 1 second in, 1 second out, 1 second pause. Those can be adjusted for comfort. Sometimes the kids can tell you. Always pressures are 40-40. I've heard that trait kids can go a little lower, 30-30. Much below 30-30. Up you go, babes. Much below 30-30 doesn't do any good.
Like 10 is not good.
No. Sometimes kids too, you might have to stop the machine and suction their mouth out if they're sick. Autumn, we really actually have not used a suction machine because we haven't had to. She's been really healthy. But sometimes if she gets real junky and stuff, she might have to spit some stuff out. Kind of gross, but you know, hey, better out than in, right, Autumn? Alright, try one more? Let's try one more, okay? You have to mash it pretty hard. Make sure there's a good seal. No leak. If it makes squeaking or farting or burping or any weird noises, then you don't want that. It has to be a good seal. Inner body. Alright, one more. Okay, good. Good. Doesn't bother this child at all. Alright, Autumn, behave yourself. Alright, what else do you want to tell anyone? You want to tell anyone anything?
Look at this.
Oh, those are instructions. We put instructions just
yeah,
in case.
like MDA camp. Oh, like you see the blue that's in.
Tell,
And here an exam.
Autumn, tell people, where do we take this?
We take it anywhere we go, even if we go to a hotel with me or camp
I'll try it.
or like a sleepover.
So any place we go, this goes, right?
Yeah.
I mean, we don't need to take it to school or anything yet, but anytime we go over a night, we need this. She needs this. This is the best piece of equipment that we could ever have. So, turn it off. We usually do more. We usually do like 5 sets of 5, but this is it for now for demonstration. You want to wave bye? Bye.